Hello, everyone, and welcome to part two of chapter one. And in this thing, we are going to look at one of the most important concepts, the most essential principle to all physiology, and that is going to be homeostasis. And as we look at that, very important homeostasis, this is going to help us understand a lot of diseases and things in the future. Now, homeostasis, homeosame, stasis, stable. This is a constant, steady state. We are looking for a stable state, a constant, internal, steady state that we want to keep. Think of it as stabilized. Basically, in healthcare, you want to keep your patient stable. You want to get them stabilized. How can I stabilize my patient? That's what you want to do. So that is an important thing. Now, auto-regulation, intrinsic regulation, and the extrinsic regulations, this is the ways we can do regulation of homeostasis. We can use auto-regulation, sometimes called intrinsic regulation. This happens within the organs being regulated or the organ system. For example, cardiovascular, controlling cardiovascular, that would be an example of intrinsic or autoregulation. Extrinsic would be outside the systems being regulated. That would be like the nervous system controlling the cardiovascular system, or the endocrine system controlling the cardiovascular system. Okay. All right. So I hope that makes sense. Now, next, what we want to talk about is the parts of homeostasis. And with that, we're going to have our stimulus, our receptor, our control center, and effector. These can all be explained by using a thermostat as an example. In a thermostat, we have a receptor, a thermometer that is associated to the room, whether it's in the thermometer itself or it's in the room that we're trying to keep regulated. We have a control center and we have an effector. And these are the main parts that are involved. Then we have a stimulus. The stimulus is going to be the change in whatever we're regulating. For example, the temperature of the room. So let's say that I have a thermostat and I want to control the room's temperature. So we go into the thermostat and we set the temperature. We set it, let's say, to 22 degrees Celsius. That's what about 71, around 71, 72 degrees Fahrenheit. I'm guesstimating in my head. So that's low 70s Fahrenheit. Now, let's say we set it to that. Now, let's say because it's cool outside, the room cools off, the heat comes on, warms the room up, and then the room warms up, it cools back off, the heat comes on, it warms up, and it does that. Or, in this case, air conditioner, they have on this screen is the air conditioner. If we set it to about 71 degrees and the room heats up because it's hot outside during the summer, the air conditioner and it warms up the room. The air conditioner comes on and it cools the room down, and it fluctuates. And the same thing would happen in a room. Now, this is what happens to fluctuations. The stimulus is a change, like in the change of the temperature of the room. The receptor would be the thermometer that would detect it. It detects the change of the stimulus. The control center perceives it, and the effector carries out the changing of the stimulus. That would be, for example, an air conditioner or a heater in your house. Okay, so if you have an automatic, in my house, I have an automatic thermostat. I keep it set to 68 degrees for the heat, and I just wear something warm and just keep the heat up a little bit. I don't like it to be too hot in my house. I'd rather wear warm clothes. Now, our set point, let's say 22 degrees Celsius, that's our set point. Now, really, there's a range. It fluctuates around a range. So the set point will have a range around it, and that will be our normal range that we have for something. Okay. So I hope that makes sense. All right. Now, positive and negative feedback. This can be a little tricky at first. This is one of those really hard to learn things at first. So let's get these we have positive feedback and negative feedback. All right. Now, positive feedback and negative feedback. Now, here we have H for homeostasis. So this would be homeostasis being achieved. Let me move this little annoying thing out of the way there. Okay. Now, let's say I have a stimulus. S for stimulus, which can go up or go down. And we have a body response. Now, the body's response, in this case, in positive feedback, the body responds opposite, or in the same direction, sorry. Body response is same direction, goes with the stimulus. So they go in the same directions, okay? The stimulus and the body's response go in the same direction. In negative feedback, we have a stimulus going up or down, and the body must respond to go opposite. Notice that in positive feedback, the body responds to go away from homeostasis, making things worse. And notice in negative feedback, the body responds going back to homeostasis, making it better. Okay, this is why we say positive pushes to completion and negative negates the stimulus. Okay, all right. So positive feedback is when the stimulus and the body's response go in the same direction. That always increases the disturbance. It takes us away from homeostasis. And in negative feedback is when the stimulus and the body's response go in opposite direction. This always brings back stability, always brings us back to homeostasis, always decreases the disturbance, negates the stimulus. Anytime we don't have the ability to lose homeostasis, if I cannot do homeostasis, that's going to produce a disease like diabetes mellitus, for example. Okay, so here's some examples. In positive feedback, when milk is produced by a human, as long as the baby's nursing, milk will be produced and the baby's done feeding. Uterine contractions during childbirth, contractions until the baby's out, no more stimulus. Fever or virus or bacteria, the body heats itself and to get rid of it and to get rid of the pathogen until the enemy is destroyed. So those are all examples of it gets worse before it gets better. Now, negative feedback, blood pressure. Blood pressure goes up. That's the stimulus. The body results to lower that blood pressure. Body's response lowers it. That would be going negative direction, negative feedback, negating. Oxygen levels get low. The body breathes deeper and harder to try to raise oxygen levels. Thirst sensation, when I get dehydrated, I get thirsty, I drink, I get more water, I become hydrated, and I've undone it. So negative feedback always undoes the stimulus. Positive feedback always makes the stimulus worse. It gets worse before it gets better, okay? All right, let's talk anatomical position. Now, why do we talk anatomical position and what's this about? Why are we mentioning it? Well, this is a common frame of reference. This is one of the things we like in science is common frames of reference. We like to have common references so that when I discuss a body and you discuss a body, we're discussing it in the same orientation. And that orientation is called the anatomical position, a common frame of reference. Now, why is it a common frame of reference? Well, every time we talk about bodies, that's how we imagine them. Now, they will be standing upright, facing forward, arms to the side, palms facing forward, and their feet together. Okay? Like this person right here. That is the anatomical position. Now, the anatomical position definitely needs to be known, and we will use it in coming up here in just a moment. Now, if your patient is lying down, they can be what we call supine. And if they're that's on their back, or they could be lying on their belly, they'd be prone. Okay, so we can use those words as well. I might add that as an extra slide down the road for another semester, just kind of getting one topic per thing. But anyway, I just have that on there. Now, let's talk about some anatomical terminologies that we need to have. Anterior means the front, posterior means behind. Now, in anatomy, ventral means belly and dorsal means back. But humans are bipeds. Because we're bipedal, our belly is on the front. So in humans, belly and anterior mean the same thing. And in humans, dorsal and posterior mean the same thing. They are equal terms, okay? That's very important that we know that, okay? All right, now here's some words I want you guys to know. So let's guess our cephalic is head. We have frontal, forehead, cranial, skull, facial, face, otic, ear, ocular, eye, oral, mouth, buccal is cheeks, the cheeks on the face, mental is chin, your chin, think about when you put your hand on your chin to think, mental, cervical is neck. Now this deals with our neck, not the female reproductive system cervical, the cervix, dealing with the cervix. Trunk, thoracic, chest or thorax, mammary, breast, abdominal, the abdomen, the umbilical, the navel or belly button, the pelvic, that's your pelvis, pretty easy. All right, upper extremity, axillary, armpit, think Axe body spray, double pits of chesty, brachial, arm, antecubital, the front of the elbow, antebrachial, your forearm, manual, your hand, carpal, the wrist, palmar, the palm, pollex, the thumb, and digits, the fingers. Sometimes we will talk about like the muscles called pollicis muscles. They deal with thumb, pollex, pollicis. Okay. Lower extremity, inguinal groin, pubic, the genital area, the pubis, femoral thigh, patellar, the kneecap, crural, the leg, tarsal, the ankle, gluteal, the buttocks, popliteal, the inner knee, sural, the calf, calcaneal, the heel, plantar, the bottom of the foot, digits, the toes, hallux, the big toe, and pedal is the foot. Okay. Go to a podiatrist to see about your foot. Okay, POTUS, foot, pedal, foot. All right, dorsal, back. You have the acromial, which also kind of deals with the upper extremity, and I do apologize that I could have put that with upper extremity. It's seen on the back side is how you see these, so that's why I've got it on posterior back, dorsal, because you can see it on the back. That's why I have it here. Not that it is part of the back, but okay, that makes sense why I did what I did. Olecranon, back of elbow, and lumbar, loin, or lower back. Okay, so those are part of the upper limb. You could see them on the back. That's why I have them there. I could put it with the upper limb. It doesn't really matter. It's not that I'm saying it's part of the back. It's just you can see it on the back. Okay, so, all right. Now, abdominopelvic regions and quadrants. Quadrants and regions. Let's get into the quadrants. Let's do this. So quadrants first. Oh, let's say it's a belly button. Okay. And let's say I took a line across the belly and a line down the middle of the belly, and I made 1, 2, 3, 4 quadrants. Now, this is the right side, and this is the left side. This is superior, and this is inferior. Now, I realize we haven't used the word superior and inferior yet, but I'm going to go ahead and put it up here. I could say upper and lower. Okay, so this is the right upper quadrant, and this is the left upper quadrant. This is the right lower quadrant, and this is the left lower quadrant. Okay? So that's your quadrants. Okay? Now, these are used by clinicians. Primarily used by clinicians. You might say a patient presents with pain in the right upper quadrant. Okay? They're primarily used by clinicians. There's a right upper quadrant, a left upper quadrant, a right lower quadrant, and a left lower quadrant. Right upper, right lower, left lower. Okay? All right. Now, there's regions. Now, these regions, they are used by anatomists. Okay? They are used by anatomists because it's more accurate. Um, and these are the regions, okay? Abdominopelvic regions. So abdominopelvic regions, a little bit different. Now let me make this a little larger. There's a belly button. And there is 1, 2, 3, 4, 5, 6, 7, 8, 9 of these, okay? Now we're going to start in the middle with the umbilical. Then we're going to go above that and have the epigastric, and below that the hypogastric, okay? Right here, I'm going to have to write it a little bit, the hypochondriac, and as well here the hypochondriac. Here is the lumbar, right lumbar, and here is the left lumbar. Down here we have the inguinal, and we also have the inguinal. Inguinal. Okay? All right. Now, one of the things I'm going to tell you is be able to take these, know where they are, because you're going to need to be able to take them. I'm going to ask you how they relate to each other. I'm going to say which one's directly above it, which one's directly below it, which one's to the left or to the right of this. I will give you one and ask you which one is where, okay? So be able to do that. Be able to use these. Don't just know they exist. Know how they relate to each other, okay? And this is what your doctor sees when they do an exam, when they do an abdominal examination, okay? All right. Now let's talk about planes. And the planes that we have, these are used in sectional anatomy, okay? Is the sectional anatomy, planes and sections. What is a plane? A plane is a three-dimensional axis, an axis in the three dimensions. Now, let me kind of explain this, is that we have what is called planes, okay? Now, in three dimensions, we would have an x-axis and a y-axis, and then coming out at us, and I'm going to draw it like this, is the z-axis. Now, x-axis, that separates us top from bottom. This is our transverse plane. And our y-axis separates us left from right. This is the sagittal plane. And the z-axis separates us front to back. That is the coronal or frontal plane. Okay? And we're going to talk about those in a minute. Now, we use this to visualize. A section is a slice on those planes. Important for MRIs, PET scans, CT scans to see internalized structures. A transverse separates top from bottom, resulting in a cross section. A sagittal left from right, resulting in a sagittal section. And frontal separates us front to back. Now remember, the plane is the axis. The section is the slice on that plane. So here we actually have the slices made of this, okay? Made by this, okay? We have these slices, okay? So you can see them. Okay. All right. Good. All right. And here is a transverse section over the whole body. From toes up to head. This is a male patient. This is a male body. I will go ahead and warn you it's a male. If you want to use it, it's IMEOS eAnatomy. A great website, eAnatomy. And they have a whole lot of stuff. They have the whole body. You have to pay for it, but the Visible Human Project, it looks right now you have to pay to actually get all the parts and all the anatomy, but it's really cool. Okay. All right, now let's learn these directional terms, okay? Now, these are great for flashcards and stuff. Okay, these are great for flashcards. So let's break them down. Superior, which also means cranial. Cranial actually means head, but in humans, superior and cranial means the same thing because our head's on top. Inferior caudal means below. Inferior means it's lower. If somebody is superior to you, means they're above you in rank. Inferior, they're below you in rank. Anterior is front, ventral is belly. Anterior and ventral mean the same thing. Posterior is behind, dorsal means back. In humans, posterior and dorsal mean the same thing. Please note that anterior and ventral mean the same thing in humans, but not in dogs, not in cats, not things like that. Same thing goes for posterior and dorsal. Medial, nearest to midline. Now imagine that we have a midline going down the middle of the body right here. If that midline, this side is nearest to that midline, that's the medial. This side is furthest from that midline, that is lateral. Okay. Now, proximal, nearest to the point of attachment. Proximal going distal. Okay. Now, if I was saying on the hand, distal, this is going proximal for the hand. This is the distal end of the forearm, but we're going proximally. Okay, distally. Okay, distant, far away. Superficial, close to the surface. Deep, further from the surface. Okay. Very important that you get these terms down. Great for flashcards. Okay, now that's about body cavities. I always kind of like to say, hey, if we took the human body and we removed all the organs, you kind of look like a canoe a little bit. We're hollow inside. We have body cavities. These body cavities, there are two of them. There's a dorsal body cavity and a ventral body cavity. Now, the dorsal body cavity is a fluid-filled space that holds the brain and spinal cord. The brain is specifically in the cranial cavity, which is in the skull, and the spinal cavity, which contains the spinal cord. Now, the ventral body cavity is on the front or belly side. We sometimes call this the coelom and has two major subcavities. There's a thoracic cavity and an abdominopelvic cavity. They are separated by the diaphragm. The thoracic cavity is above the diaphragm and abdominopelvic cavity is below the diaphragm. Now, in the thoracic cavity, we have the two pleural cavities that hold the lungs. We had the mediastinum that is between the pleural cavities and surrounding the pericardial cavity, around the heart and behind the heart. And then we have the abdominopelvic cavity, pericardial cavity, that has the heart. Then in the abdominopelvic cavity, we have the abdominal cavity that holds your digestive organs and the pelvic cavity that holds the bladder and reproductive structures. Now look right here. In purple, we have the pleural cavities holding the lungs. In yellow, the mediastinum. And in red, the pericardial cavity holding the heart. Okay. Now, there are serous membranes. And let's talk about this a little bit. There are visceral and parietal layers. I'm going to go ahead and do this. Let's say I have an organ right here just for organs. Let's make that a little bit bigger, shall we? Okay, so let's say we have an organ right here, like the heart, for example, okay? And let's say right here we have the body wall, okay? Around it, is a serous membrane. And they are double-lined, sealed membranes, okay, that surround organs. Now they have two layers. They have the one nearest to the organ is the visceral layer, and the one nearest the body wall or on the body wall called the parietal layer, okay? Now, sorry, I lost where I was. The visceral layer is serous membrane is closest to the organs, the viscera. The parietal layer is always closest to or attached to the muscular body wall. Now, in the thoracic cavity, there are two membranes. There's a visceral and parietal layer. There is the pleura around the lungs and pericardium around the heart, both visceral and parietal. Abdominopelvic cavity contains the peritoneum. That's the only one they have there, okay? Now, there are other membranes like the omentum and stuff like that that's also associated to the gut, but they're not serous membranes, okay? So, all right, so here you can see there is a parietal and visceral right here. There is a visceral layer here and a parietal here, parietal and visceral. Visceral near the organ, parietal on the outside. There is a pericardium around the heart, a pleura around the lungs, and a peritoneum around the abdominal cavity, okay? Now, last thing we want to talk about is the organs and what cavities they're in. The heart, lungs, larynx, and trachea are in your thoracic cavity. The liver, gallbladder, stomach, pancreas, spleen, large and small intestines, bladder, and kidneys are in the abdominal pelvic cavity. That's where we're going to end it. That is the thing we were asked to talk about. It will be on the test for sure. So just please, as you go through that, please do that, okay? All right, guys, this concludes my video, and we'll see you in the next chapter. Thank you, and we'll see you at the end. Thank you, and have a great day.